10 most common essential nutrient deficiencies in women. Greetings ladies, and welcome back to Well Woman Wisdom channel. Today we'll be shedding light on a most significant wellness topic, most common essential nutrient deficiencies in women. These deficiencies can have significant consequences on women's health and impact various aspects of your well-being. If you are consistently low in energy, moody or irritable, this could be due to some deficiencies in essential minerals in your bloodstream. How can you be sure and what can you do? These are what today's video is all about. We'll first start by looking at the causes of these deficiencies and how you can determine if you have any deficiencies. What causes nutrient deficiencies? There are several factors that can lead to essential nutrient deficiencies. What you eat affects you in many ways. Your body uses the nutrients in food to perform several functions, and without the proper nutrients, your body suffers. A nutritional deficiency can develop in your body when you don't consume an optimal amount of nutrients. It can happen as a result of a poor diet or an impairment of nutrient absorption due to a disease or medication intake. Deficiencies can also result if your body is unable to absorb nutrients properly. Either of these conditions can lead to a deficiency on their own or in combination. One often overlooked deficiency culprit is stress. Physical or emotional stress can deplete the body of several nutrients, while also reducing the capability to absorb and utilize many nutrients. Another factor that can inhibit proper nutrient absorption is often the presence of heavy metals and chemical toxins. How to determine if you have nutrient deficiencies? There are two sets of tests that can help determine if you have nutrient deficiencies. One is the usual serum blood test, and the other is the hair tissue mineral analysis, hTMA. For the analysis, a sampled hair is obtained by cutting the first 1.5 inches of hair closest to the scalp at the nape of your neck. It is then prepared in a licensed clinical laboratory through a series of chemical and high-temperature digestive procedures. Hair tissue mineral analysis is a more effective test than serum blood test. This is because it can provide a record of past as well as present trace element levels, meaning the biological activity. It also provides information of substances entering from the blood serum and external sources. Furthermore, hair mineral analysis uses a non-invasive testing method. It is also cost-effective and is invaluable in assessing toxic metal levels. You receive a clear and concise finding of deficiencies and toxic materials. Before we continue, if you haven't yet subscribed to our channel, click the subscribe button and the notification bell icon so you won't miss any of our future videos. Now let's dive in and explore each of the 10 most common deficiencies, its consequences, and the best food sources to rectify the issues effectively. Number 1. Iron deficiency. Iron deficiency affects millions of women worldwide, with approximately 30% of women of reproductive age experiencing iron deficiency anemia. This deficiency can lead to fatigue, weakness, and impaired cognitive function. Severe iron deficiency is often characterized by pale skin, brittle nails, and shortness of breath. Good food sources of iron include lean meats, poultry, fish, legumes, tofu, fortified cereals, and dark leafy greens. Number 2. Calcium deficiency. Calcium deficiency is globally prevalent, particularly among women in low-income countries. Calcium is crucial for bone health and muscle function. Insufficient calcium intake increases the risk of osteoporosis and fractures, impacting women's long-term health. Food sources rich in calcium include dairy products, fortified plant-based alternatives, almonds, and dark leafy greens. Number 3. Vitamin D deficiency. Vitamin D deficiency is also a widespread issue, affecting around 1 billion people globally. Women, especially those with limited sun exposure, are at higher risk. Deficiency can lead to weakened bones, muscle weakness, and an increased risk of chronic diseases. Did you know that your skin color determines the absorption of vitamin D? For instance, although people with darker skin are better protected against UV rays, but in order for their body to absorb the same amount of vitamin D. As people with lighter skin, they need to spend more time in the sun. It is scientifically proven that non-Hispanic and Black people generally have higher rates of vitamin D deficiency. This means that the darker your skin, the less vitamin D you make from sunlight exposure. Vitamin D has two main forms, D2 and D3. Although your body can absorb both types of vitamin D. However, studies have shown that vitamin D3 increases your levels more effectively than vitamin D2. Being obese, having osteoporosis, or suffering from malabsorption disorders like celiac disease or inflammatory bowel disease also increase risks of vitamin D deficiency. Fatty fish, mackerel, egg yolks, fortified dairy products, and exposure to sunlight are good sources of vitamin D. Number 4. Vitamin B12 deficiency. Vitamin B12 plays a vital role in red blood cell formation, neurological function, and DNA synthesis. Women who follow vegetarian or vegan diets are at higher risk of vitamin B12 deficiency since it is primarily found in animal products. An estimated 10 to 15% of the global population is deficient in vitamin B12, with women, particularly vegetarians and vegans, at increased risk. Symptoms of vitamin B12 deficiency may include fatigue, weakness, tingling or numbness in the hands and feet, and difficulty maintaining balance. Severe deficiency can lead to irreversible nerve damage. Deficiency can result in anemia, neurological issues, and fatigue. Meat, poultry, fish, eggs, dairy products, and fortified breakfast cereals are essential sources of vitamin B12. Number 5. Folate deficiency. Folate, also known as vitamin B9, is essential for DNA synthesis and cell division, making it especially crucial during pregnancy for fetal development. Women of childbearing age who lack sufficient folate intake are at increased risk of neural tube defects in infants. Additionally, folate deficiency can lead to megaloblastic anemia, characterized by enlarged and underdeveloped red blood cells. The deficiency remains a significant concern globally, particularly in regions with limited access to fortified foods. Dark leafy greens, legumes, citrus fruits, avocados, spinach, kale, and fortified grains are important sources of folate. Number 6. Magnesium deficiency. Magnesium is involved in over 300 biochemical reactions in the body. It plays an important role in muscle and nerve functions, energy production, and bone health. Many women do not consume enough magnesium-rich foods, leading to deficiency. Despite magnesium being widely available in foods, deficiencies are common worldwide. Up to 75% of adults don't meet the recommended intake. Symptoms of magnesium deficiency can include muscle cramps, fatigue, irritability, and cardiovascular issues such as abnormal heart rhythm and heart palpitation. Nuts, seeds, whole grains, legumes, and leafy greens like spinach and Swiss chard are rich sources of magnesium. Number 7. Omega-3 fatty acid deficiency. Omega-3 fatty acids, such as EPA and DHA, are essential for brain health, heart health, and reducing inflammation. Women who do not consume enough fatty fish or plant-based sources of omega-3s may be deficient. Its deficiency is prevalent worldwide, particularly in regions with limited access to fatty fish. Deficiency symptoms may include dry skin, brittle hair and nails, joint pain, and mood swing. Low intake is associated with increased inflammation and cardiovascular risk. Fatty fish, walnuts, flax seeds, chia seeds, and hemp seeds are important sources of omega-3 fatty acids. Number 8. Iodine deficiency. Iodine is crucial for thyroid function and the production of thyroid hormones, which regulate metabolism, growth, and development. Women, especially pregnant and breastfeeding women, require higher iodine intake. Its deficiency affects approximately 2 billion people globally, with pregnant women and young children being particularly vulnerable. Iodine deficiency can lead to thyroid disorders, such as hypothyroidism and goiter, and impaired cognitive development in infants born to iodine-deficient mothers. Iodized salt, seafood, such as cod, shrimp and seaweed, dairy products, and fortified grains are key sources of iodine. Number 9. Vitamin A deficiency. vitamin A deficiency remains a significant public health issue, affecting millions of women and children globally. Lack of vitamin A can lead to vision impairment, compromised immune function, and increased mortality rates. Since vitamin A is fat-soluble, it is more efficiently absorbed into the bloodstream when eaten with fat. Liver, sweet potatoes, yellow vegetables such as carrots, pumpkin squash, and leafy greens are rich sources of vitamin A. Other good sources are oranges, mangoes, papaya, salmon, and eggs. Number 10. Vitamin C deficiency. While scurvy is rare today, vitamin C deficiency remains a concern in certain populations, particularly those with limited access to fresh fruits and vegetables. Insufficient intake can lead to impaired wound healing and increased susceptibility to infections. Citrus fruits, bell peppers, strawberries, broccoli, and kiwi are rich sources of vitamin C. These 10 essential nutrient deficiencies have global implications on women's health. To address these concerns, it's essential to prioritize a balanced diet rich in nutrient-dense foods. If you suspect you may be deficient in any of these nutrients, prioritize your health and find an excellent holistic doctor for personalized guidance. I would like to end today's video with this quote: "Without a daily supply of proteins, vitamins, and minerals, no matter how much energy we get in the form of calories, our bodies and minds deteriorate because we are not able to fully replace the dying cells in our internal and external organs." I wish you the fortitude to remain vigilant for a healthy body, mind, and soul. Thanks for watching, and if you've loved the video, be sure to like, share, and subscribe for more health wisdom and holistic approach to life. Until next time, take care and stay well.